Okay. Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Aiman Kimber Ramli. I will talk about the pacemaker system and the types of pacemaker. Firstly, pacemaker is a small battery operated device that help regulate the heartbeat by delivering electrical impulse to the heart. Normally, for normal people, we have natural pacemaker that is sinoatrial node. It located at the atrium of the heart. The natural pacemaker generate electrical signal that travel to the bodies and cause the contract and blood through the body. Pacemaker is for people that has heart signaling. Maybe their natural pacemaker is damaged or weak and make their heartbeat go faster or slower. Pacemaker consists two part, that is pulse generator and the leads. Pulse generator is a small battery powered device that implant under skin and it near to the collarbone. Pulse generator contain battery, electronic circuits and a computer that monitor and regulate the heart activities. And the others is leads. It was thin insulated wires connect the pulse generator to the heart. Leads deliver electrical impulse from pacemaker to the heart and transmit information about the heart activities back to the pacemaker. There are several types of pacemaker. First is single chamber pacemaker. This type is they send electrical signal to the lower right chamber, which is ventricle of the heart, and it is used for people with bradycardia or heart block in the lower chambers. Second is dual chamber pacemaker. This type of pacemaker send electrical signal to both the upper and lower right heart chambers, that is atrium and ventricle. It designed to mimic the heart's natural pacing system and provide more efficient coordination between the atria and ventricles. And then we have biventricular pacemaker, which is cardiac resynchronization therapy. This type of pacemaker is used for people that has heart failure, and it sends electric signal to both lower heart chambers, which is ventricle, to help the heart muscle function more efficiently. And it contains implantable cardioverter defibrillator, which is ICD, to provide additional support for the heart. And then we have leadless pacemaker. For this type of pacemaker, it was smaller and does not require leads. It placed directly to the heart using catheter. It's eliminating the need for a surgical incision and reducing the risk of complication associated with leads. And then lastly, we have wireless pacemaker. This type is combines of the pulse generator and electrode into a single device, and it positioned at right ventricle. This type of pacemaker eliminates the need for leads and can be implemented using a minimally invasive procedure.
Okay, now I, Leo Banu, will be explaining about the risk and precautions of using a pacemaker. So, I have listed around six risks and precautions we have to follow. So, first one is infection. So, An infection can occur at the site of the pacemaker implantation. So, how do we prevent it? Or precautions could be taken is a proper sterile technique during surgery, post-operative care, and sometimes antibiotics can be helped to prevent infection. Infections may require removal of the pacemaker and antibiotic treatment. So the second one will be bleeding hematoma, bleeding or hematoma. So bleeding or collection of blood, which is also known as hematoma, can occur at the implant site. Prevention of management will be carefully surgical techniques and post-operative monitoring. In some cases, surgical intervention may be required to address significant bleeding of hematoma. Okay, the third one will be device malfunction. Description: the pacemaker may fail to function properly due to electronic issues, battery failure, or LED problems. So, the precautions that we can take is that regular checkups and monitoring to ensure the device is working correctly. Malfunctioning devices may need reprogramming or replacement. Okay, the fourth risk maybe is thrombosis, where blood clots can form on the leads or at the implantation site. So the precautions could be taken is that blood thinners may be prescribed to reduce the risk of clot formation. If clots develop, they may need medical or surgical treatment. The fifth one will be pacemaker syndrome, a condition where the pacemaker causes symptoms such as dizziness, palpitation, and shortness of breath due to the loss of normal atrioventricular frequency. So the precaution that we can take is adjusting the pacemaker settings or, in some cases, upgrading to a different type of pacemaker. And the last one will be electromagnetic interference. So external electronic devices and magnetic fields can interfere with pacemaker function. So, how to prevent that or precaution to handle that is patients are advised to avoid close proximity to strong electromagnetic fields and inform healthcare providers and security personnel about their pacemaker.
Assalamualaikum, and my name is Amza Azri Amruddin, and my metric number is CE210543. So today I will explain about the material used in a pacemaker and the uses of the material in our heart. Okay, so as we know that the casing of the housing of the pacemaker there is contain electronic circuitry and battery is made of the titanium. It because as we know that titanium is biocompatible, that is not reactive with the tissue, and also light and strong. So for the battery, usually it's from the lithium, because it's a reliable and stable voltage output, and also lasting between 5 and 15 years. Next, for the integrated circuit and the semiconductor component is usually a silicon. So this component so essential for the device functioning, including sensing heart activity and generating electrical pulse. So this material are used in various part of the electronic circuitry and for installation as a substrate. So next, I will move to the function, how the system function in the heart. So I will start with the pulse generator, the main component of the pacemaker, and the function of the pulse generator is to generate electrical impulse and to regulate heart rate. And next, for the leads, as we know, the leads are the thin wire that connect the pulse generator, and it also functions to transmit electrical impulse to regulate heart rate. And move to the next component, that is electrode. Electrodes are the tips of the lead that is at the end of the lead, and its function to transmit the electrical impulse to the heart. And so as we can see here, the pacemaker is designed to regulate the heart rhythm, maintain a normal heart rate, and address abnormal heart rhythm. Okay, so by continuous monitoring and adjusting the heart rate, pacemaker ensure that the heart function within a normal range and providing a vital function in managing cardiac condition. So that's